Hello, I'm D.Emady, pharmacist since 1998, graduated from Texas Southern University School of Pharmacy in Houston, Texas, back in 1998. It's been a while. Anyhow, I'm going to discuss with you why it's so important to calculate the dosage of opioid drugs, as you know. So I'll change this color for you. Opioids. These are the drugs that are derived from, there are morphine derivatives. So morphine derivatives. Examples of opioids are codeine, hydrocodone, oxycodone, morphine itself, which comes as morphine sulfate. So these are morphines. Now, the calculation of morphine dosage is very important in a national sample of Veteran Health Administration. Patients with chronic pain receiving opioids from 2004 to 2009. Patients who died of the opioid overdose were prescribed average of 98 morphine milliequivalents. This is a calculation they do for the amount of morphine that you use per dosage, and so the 98 morphine milliequivalent caused the fatal situation on average, and other patients were just receiving 48. So the one that didn't harm them, they were receiving 48 MME, and the one that was fatal, they received 98 MME. So this was safer. Now, let's go back here. I want to show you there is a study that these are the information I'm providing you is also on CDC, and I'm using that as a reference. Dosage at about 50 morphine milli equivalent, so 50 morphine milli equivalent. Dosages above that amount increase risk of overdose by twofold. So dosages of 50 morphine milli equivalent increases the risk of overdose by twofold. Now, in order to find out what exactly we mean by 50 morphine milli equivalent or 90 morphine milli equivalent, there is some examples. And there are some online calculators that you can put the medication. Say, if you have hydrocodone, this is a common prescription drug that is actually Schedule 2, but it's very commonly prescribed. So I use the hydrocodone 10-325. So if you take, if the prescription says take 1 tablet by mouth every 4 hours, that makes it 6 tablets per day. So, and this 10 milligram of hydrocodone equals to 10 morphine milli equivalent. So times 6, it gives you 60 morphine milli equivalent. So you may want to call the doctor and see if they can lower it to either below 50 or the max 50 MME. Now, there are other medicines that, as you were told, there is a calculator online. There are several sites that provide the calculator. You can put the dosage, and it gives you the morphine milli equivalent. And as I said, you have to stay around this figure, which is 50, to be on the safe side. And always check for patients to make sure they're not multi-dosing or taking different medicine that increases the chance of overdose for opioids. Thanks for watching this video, and please either subscribe or like. That way I know that I can make better videos in the future and improve. Your opinion is appreciated. That way I can improve the videos. Thank you.